Pharmaceutical giants are gearing up to flood the market with affordable generics. 2026 is expected to mark not just the arrival of the next generation of weight loss medication, but the beginning of a nationwide health transformation. But is this transformation entirely welcome? And are we prepared for what it brings? But first, let's understand why now? Globally, GLP-1 drugs like Ozempic, Wegovy have already helped nearly 20 million people lose weight since 2021. But in India, access has been painfully slow and painfully expensive. Until now, the core ingredient in these blockbuster drugs, it's called Semaglutide, is going off patent in 2026. Not just in India, but in over 80 countries, including Canada, China, Brazil, and Saudi Arabia. Now, what that means is, once it happens, prices are expected to fall hard by as much as 85 to 90%. That means what once cost you about 20 to 30,000 rupees a month could soon be available at just 2,500 to 4,000 a month. This will be a fundamental shift in who gets to access obesity care. We are talking about weight loss drugs from elite clinics in metros and putting them in the hands of everyday Indians. With nearly 33% of Indian adults struggling with obesity, this could have a massive public health impact. But with mass access comes a set of new concerns. While the promise of affordable treatment is exciting, doctors are urging caution. India's leading endocrinologist, Dr. Amrish Mittal says, and I quote, "Whenever prices go down, it always helps our patients. I assume the quality checks will be maintained as generics enter. The challenge, of course, is that misuse will become easier. Misuse might already be happening and it could further increase. But overall, I think the benefits outweigh the challenges. I'm quite optimistic about this move." The issue of misuse is a valid one, a concerning one. And to handle this misuse, countries like Portugal have given only doctors with approved specialties permits to prescribe these drugs as a way of controlling it. Something the doctors in India are now exploring. Padma Shri Dr. Shashank Joshi, who has been at the forefront of diabetes and obesity care in India, says, and I quote, "If and when the drugs become more affordable, it will have a clear impact on the entire spectrum of more than 200 conditions which are impacted with people living with obesity. The cosmetic use and the misuse off-label needs to be contained because these drugs have compelling data on complications and even comorbidities must be given under expert supervision." So it's clear there is a genuine sounding of caution. But there is also a flip side to the generic race for weight loss drugs. With patents expiring, the doors will wide open to Indian pharma players to jump in, and they are wasting no time. Over 10 Indian companies have already filed for clinical trials, mostly for oral versions of semaglutide, meaning injections won't be required anymore. Add to that the competition from Chinese manufacturers, and what you get is a perfect storm of falling prices. But remember, this isn't just a drug story. The ripple effects across the healthcare ecosystem could be enormous. For example, insurers may begin covering weight loss therapies. Hospitals may roll out dedicated obesity programs. Startups are already building subscription-based models that combine medication, coaching, and lifestyle tracking. What this means? In conclusion, what does this mean for you and me? What once costed 30,000 a month treatment is set to drop to 3,000 or less. That's a game changer, not just for individuals, but for India's public health system. 2025 has already seen early entry of next-gen weight loss drugs into the Indian market. 2026 will be the year they go mainstream. But if we want this revolution to truly succeed, we need more than cheaper drugs. We need education, regulation, and ethical oversight. Because if we are not careful, India could end up facing the same problems the West is already struggling with, from overuse and side effects to social media-fueled obsession. And that's not the kind of healthcare transformation anyone wants.